Bowel cancer is the second deadliest cancer worldwide. Could you spot the signs that you might have bowel cancer? In this video, I'll show you how to prevent it. Is it possible to prevent colorectal or bowel cancer? What are the risk factors? What causes someone to develop this type of cancer? What are the 8 often overlooked signs? We tend to ignore these signs. That's something we should never do. So learn these signs to seek help early when cure chances are higher. I'll also discuss the tests. Can a fecal occult blood test help? Can colonoscopy prevent cancer, or is it risky? This video covers everything about bowel or colon cancer. First, I want you to understand that this type of cancer usually starts from a polyp. This polyp typically develops over time and eventually becomes cancerous. Not all polyps turn into cancer, but it's important to note that most cancers start from these polyps. So, what are the 8 signs and symptoms that are often overlooked? The first sign of bowel cancer you should be aware of is a change in bowel habits. When I say change, it's not just constipation, it's any noticeable difference. For example, you used to have bowel movements 5 times a week. Now you're going 10 times. Uh-oh. Diarrhea can also indicate something's wrong, like bowel cancer. The opposite is true too. You went 5 times, now it's twice or once. That's a major red flag. It's worth noting that some types of colorectal cancer alternate between diarrhea and constipation. This is also a major warning sign. So I'll emphasize this. Changes in your regular bowel habits. Did you start eating more or less fiber or notice any other changes? Can't pinpoint what happened? You must investigate if it's not bowel cancer. Don't ignore it at this stage. Got it? The second sign is abdominal pain. This pain is often described as cramping, but it can also be sharp. Pain is subjective, but it's discomfort in the belly area. This also needs investigation, okay? If there's no clear cause, like an intestinal infection, it's crucial to note this. Often viewers might think any pain means cancer. That's not always the case. These are warning signs that'll make you seek help, okay? None of these signs are 100% certain in medicine. We have a saying in medicine and love, nothing's always or never. So, pay attention to understand how the disease works. And sign number 3 is blood in the stool. But I'll also mention darker stools. Why? A tumor can bleed, and depending on its location, you'll see blood in the stool if it's near the end of the intestine. But if it's further up, the blood might be digested, then the symptom will be darker stools. So, changes in stool pattern, darkening, or blood in the stool. Many people might think, oh, but most of the time, bleeding is due to hemorrhoids. That's true. Usually it's a benign lesion that bleeds, not cancer, but it still needs to be checked out. Bleeding isn't normal. As an endocrinologist, I screen for other issues too. Many say, I bleed, but it's normal. Sometimes people bleed for months or a year without getting it checked. During a diabetes or thyroid checkup, we might end up diagnosing something else. So it's crucial to seek help quickly if you're experiencing bleeding, okay? Sign number 4 is bloating, abdominal distension, or excessive gas. Depending on the tumor's location, it can also cause an obstruction. It's not always a complete blockage that stops everything. Sometimes it's gradual, causing increased swelling, digestive issues, and bloating. So this also needs evaluation. Sign number 5 is fatigue. This fatigue occurs due to decreased red blood cells causing anemia. Remember the signs of iron deficiency anemia, one being bleeding? Bleeding can lead to anemia. You'll notice pallor and difficulty with physical activities. You used to climb 4 flights easily, now one leaves you winded. You're struggling to maintain your usual energy levels. Nails become weaker and hair starts falling out. So these could be signs of anemia, which also need investigation. Why does this person have anemia? Why are the red blood cells so small? This is a sign we call microcytosis. Usually microcytosis is caused by iron deficiency. So we need to connect the dots, but I want you to pay attention to fatigue. You wake up and already feel tired. There's a decrease in physical fitness. You need to be aware of this. Adding to the sign in the blood count, small red cells or microcytosis. Sign number 6, also very important, is tenesmus. What's that? You go to the bathroom but feel like you haven't fully evacuated. This could indicate something's wrong, so it needs checking. It seems some stool always remains, right? You can't evacuate completely, so we need to check if there's an obstruction or tumor mass causing this feeling that you can't fully evacuate. Sign number 7 is a change in stool shape. Stools may become narrower due to this constriction, especially when the tumor is near the end of the intestine, called ribbon stools. Pay close attention to this sign and seek medical help. Sign number 8, the last one to note, is a more objective sign. Weight loss. You're losing weight without explanation. This also needs to be investigated for potential cancer. Cancer can cause nausea, fatigue, reduced appetite, and intestinal changes. These factors can lead to weight loss, okay? There are many factors, but I'll highlight these 2 common ones. But why did I say it's subjective? When should we investigate weight loss? When someone loses 10% of their weight in 6 months or less without knowing why. This calls for a deeper look into why it's happening. You haven't started dieting, exercising, or made any changes to explain the weight loss. That's a major red flag, folks. Now let's discuss prevention, protection, and risk factors. Genetics plays a role in colon cancer, but there's much more to consider. What other risk factors can you control? Frequent intake of ultra-processed foods and meats with preservatives. Eating these 3+ times weekly raises bowel cancer risk. So avoid ham, turkey breasts, salami, and other cured meats. Now you might be thinking, but I heard turkey breast is healthy. Well, it has that reputation, but it also contains preservatives that may increase colon cancer risk. So it's best to avoid it. This isn't about having a bit of salami once a year at Christmas. It's about regular consumption 3 or more times a week. In practice, talking with patients, I see this is extremely common, okay? Many people end up eating these foods every 2 or 3 days. What about you, Sue? Have you analyzed your diet? This could be putting you at a higher risk of colon cancer. I've talked about food. Now let's highlight obesity and increased fat tissue. Why? We now know fatty tissue can produce inflammatory substances, a recent discovery. We didn't know this, but studies showed obese people have a higher risk of colon cancer. Digging deeper beyond ultra-processed foods, we found weight is also a factor. So maintaining a healthy weight can reduce your risk of colon cancer. Obesity also increases risks for other cancers like breast and prostate. Did you know that? Liver cancer too. That's why weight control is crucial. A sedentary lifestyle is unhealthy and increases cancer risk. High sugar foods may also play a role, but the link is less clear. I'll highlight these other factors I mentioned. You probably know this. Alcohol and smoking greatly increase colon cancer risk. So how can you protect yourself? I'll discuss if there are ways to avoid it, including diagnosis and prevention in many cases. You can safeguard yourself and lower the risk of this cancer by eating the right foods. While these foods won't eliminate the risk or fight cancer, as many videos lacking scientific proof claim, they may help reduce the danger. It's crucial. It doesn't cure, but greatly reduces risk. You can protect yourself. Listen to how important this is. Foods like avocado and fish have good fats, while coffee and turmeric have anti-inflammatory properties. What other foods? Extra virgin olive oil, veggies, Mediterranean diet with grains, and antioxidant-rich berries. These foods can help your body. No, just drinking coffee won't prevent cancer, but a combination of actions and foods can reduce your risk. Reduce, not eliminate. Got it? So these foods, including cocoa, have anti-inflammatories that can help. When I talk about turmeric, for example, I mean using it to season food, not taking turmeric capsules or other vegetable supplements. Many asked if eggplant capsules could help with cholesterol after my video. No, eat the whole food. You get vitamins, anti-inflammatories, and fibers that aid digestion and reduce colon cancer risk. Since I mentioned fibers, let's talk about seeds. They're crucial. Chia, flax, and pumpkin seeds can all help with this. Why? These fibers are proven to aid digestion. Adding these seeds easily helps you reach 25 grams of fiber daily in a simple, practical way. They can help reduce the risk of colon cancer. Fiber improves gut transit, reducing contact with harmful substances. So, consuming fiber is extremely important. You can protect yourself by choosing a healthy diet. Now, how can you often prevent colon cancer? This part of the video is crucial. I'll tell you about 2 tests. The first is the fecal occult blood test. Can this test prevent cancer? The answer is no, it can't. Often it can't even diagnose cancer. So this test doesn't replace a colonoscopy. Well, why not? Many cancers don't bleed constantly, so the test may miss them. You might falsely think all's well with no or intermittent bleeding. It bleeds for a day or 2, then stops. You test when it's not bleeding and the result looks fine. That's what we call a false negative. The fecal occult blood test has specific uses, but it's not a screening test. It doesn't replace colonoscopy. Don't fall for online misinformation. This can lead to cancer if you skip other tests, thinking you're fine. In fact, you might have hidden cancer that will later show many signs and symptoms, making treatment very difficult. So what's the recommendation? If you're 45 or older, or if a close relative had cancer earlier, like at 44, start screening 10 years before that age. So at 34, if they had it at 47, you'd start at 37. If there's no family history, the new recommendation is to start at 45. It's not 50 anymore, okay? New studies show that starting 5 years earlier helps reduce bowel cancer deaths. Not all guidelines have changed, but many have, all right? So now the recommended age is 45. If you haven't had this test yet, talk to your doctor about getting a colonoscopy. It has clear benefits. Why is this test so important? In a colonoscopy, you saw that cancer often starts from a polyp, right? Colonoscopy can find, remove, and analyze these polyps. So if it's a polyp that might become cancer, the exam can prevent it right there. It's not just a test, it can actually remove polyps too. Or if you have early stage cancer without symptoms, you can get treatment with a much higher cure rate. That's why getting a colonoscopy is crucial. I know there are videos saying colonoscopies are dangerous. That's a big myth and actually increases your risk, okay? Sure, there's a tiny risk, but the chance of finding cancer or removing precancerous polyps is way, way higher. So it's worth talking to your doctor about getting this exam. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Let me know if you've had the exam and how it went for you.